Greetings, Wellings. I'm Dr. Khan, back with another reaction video to the hit HBO Max show called The Pitt. This is episode 11. This show is fiery, fierce, and it's also the most honest depiction of how the emergency room and hospitals work. It shows the semantics and dynamics between administration and actual healthcare and patient dynamics. Let's get into it.
Lily, I'm here. Sorry, I got a little lost.
Your direction! Check her, Dr. King.
Okay, go ahead. Got this.
I see hair. Baby's hair. Natalie, you're crowning.
What you see here is basically the last active stage of labor. It's called crowning. It's when the baby's head becomes visible at the vaginal opening. It's just like baby's coming and baby's coming now.
It's coming! It's coming!
Okay, we're out of gloves, so I'm gonna catch it with this Panda Express bag.
The chance we'll deliver on the next contraction. Right, head is out. All right, I'm gonna need another big push from you. You got this.
What do you? Woo! So let's just talk about the miracle that is childbirth. How crazy is it that this little baby is cooking in this woman's uterus for about 10 months. And now is the time where the baby's like, I'm done, I'm cooked, I'm ready, I'm coming out. Childbirth is something that's so beautiful. I'm so fortunate I got to witness it. Most medical students get to witness it.
Hey, let's get our med student over here.
Medical school, you're exposed to so many different types of specialties. It's not the time that you're gonna be stuck in one specialty. It's the time you're exposed to all of them so that you can decide what you want to do your residency in.
Big differential of pretty serious stuff to rule out.
So what's your plan?
Besides Zofran, CBC, CMP, IV fluids, morphine, maybe CT.
Remember how I said you get good at spotting the fakers?
Yeah.
He's exhibiting every sign of opiate withdrawal. Agitation, restlessness, perspiration. He's checking every box.
Yeah.
Right. But he said he doesn't take drugs and seldom drinks alcohol, so that's exactly what he would want you to believe if he was drug seeking. So how do we treat him?
By getting him to admit his opiate usage.
Right. How do we do
Good
that?
By
luck.
being smarter than the patient.
So this patient is exhibiting all the signs and symptoms of opioid withdrawal, but he is in major denial. It's a defense mechanism and it's universal, and what they think is like protecting them. Interestingly, your body will tell a story way before your brain will ever understand it. I mean, his vital signs are going wild. His blood pressure is sky high, his heart rate's sky high. He says he doesn't drink or smoke, but he's clearly crawling out of his skin in withdrawal.
48-year-old cirrhotic here for hematemesis.
Shavati, I need you on suction. With cirrhosis, you get enlarged veins under pressure at the entry of the stomach, varicose veins, and they can burst.
What does that mean?
Basically, a 48-year-old with cirrhosis and hematemesis, that means that hematemesis means they're vomiting blood. Emesis is vomiting and heme is blood, so they're vomiting blood. The patient's vomiting blood because in liver cirrhosis, there's a backup of pressure in the veins responsible for draining the liver. It backs up all the way to the veins in the esophagus area. So it's called esophageal varices, and they rupture and they cause GI bleed. This is a GI emergency and could be a surgical emergency if they can't control the bleeding with localized measures. Number one cause of liver cirrhosis in America is alcoholic liver disease. Cirrhotic patients are some of the sickest patients that I've ever admitted as a hospitalist. Whenever I get a cirrhosis patient, I'd be like super careful and super cautious just because they can decompensate so quickly. The liver is responsible for detoxification, creating the blood protein clotting factors, and also for metabolism of sugar and all the glucose. The liver is incredibly important.
Rotating.
Ooh, baby!
Ow. Fuck.
Perfect.
You're right there. Give me one good push.
He's pretty quiet.
Wow.
Sometimes it takes him a minute. Put the baby on a pulse ox and a heart monitor.
Heart rate is 95.
Too slow. This kid needs oxygen. Come on, baby.
If a baby isn't crying or breathing within 30 seconds to a minute, here's what typically happens. Critical sign that they're not getting enough oxygen and their lungs are not breathing on their own. Babies are getting oxygen through the placenta. Oxygen travels through the umbilical cord to the placenta to the baby. And then when the baby is born and now exposed to oxygen and doesn't have the placenta to rely on, their first thing they have to do is take a deep, big breath, which is usually with a cry that inflates the lungs. The placenta's role stops. The umbilical cord is clamped, which stops the placental oxygen. The lungs are filled with air and oxygen exchange begins now. That means the fetal circulation path is closed.
So I'm clear. Our plan is lying to patients.
Okay.
I didn't lie.
That's
Bupe is a
not-
morphine-like drug, binds to the same receptor.
He said he isn't an addict, so why give him an opiate agonist?
Because I don't believe him, and I know this will work. Then, once he feels better, we can get him to admit to his addiction and treat him long-term.
If you say so.
First, do no harm, then do what's best for the patient.
He was like, so we're lying to patients now? Look, it's very hard for people to admit when they're in denial. If point blank she asked him, you're on drugs, and he says point blank no, but she knows as a doctor with treated multiple patients with the same signs and symptoms, she's going to have to do what she has to do to get him the right treatment. She said it was a morphine-like drug, and that's true. So he read between the lines and he tried to call it out as a teaching point, but first do no harm and then do what's right for the patient.
Can I put my legs down now? As soon as your placenta's out. Here it comes.
Oh, wow.
What?
That's a lot of blood. What's going on?
This happens sometimes. We have to have the uterus clamped back down. Starting uterine massage. 2 units from the blood bank, just in case. Call OB and get Robbie.
The baby's delivered, okay, then the placenta gets delivered, and sometimes the placenta doesn't get delivered, okay? The uterus and the placenta has a large amount of blood supply. You can imagine it's housing like 2 people and growing a baby. That's called a massive hemorrhage, and what they just activated was something called the MTP protocol, I think, massive transfusion protocol. That's when they all hands on deck for getting all the blood in the hospital to this patient. That person needs a lot of blood and needs it fast. She's going to be in hemorrhagic shock if they cannot stop the bleeding or resuscitate fast enough.
You know how much IVF costs? Oh, as fertility doctors are making a killing. Even if my insurance would pay for more rounds or I could pay out of pocket, I'm not sure I could go through this again. Maybe it's just not meant to be.
I've never known you to give up on anything, except maybe me. I had it coming.
Oh, did they date? What was that? Okay, but let's first talk about what she said. IVF is in vitro fertilization, and the cost of a single cycle ranges between $14,000 and $20,000. Additional stuff like genetic testing, egg donation, sperm donation, or egg freezing, which per cycle costs between $7,000 and $10,000, and that's sometimes with or without the medications and the hormones needed, but it is very expensive and multiple cycles often are necessary, so that cost can get up to $50,000 pretty quickly. Most insurance plans do not cover IVF.
Using Bupe was unconventional, and while it wasn't dangerous, it could be subject for scrutiny, which I really don't need any more of right now from Gloria. I expect a level of this from medical students. I expect more from an R3. The medication we gave you wasn't morphine. It was something called buprenorphine. It's a medicine specifically targeted to treat opioid withdrawal. That's why it worked. All indicators are that you have been using opioids. Hydrocodone, oxycodone.
I told him I don't do drugs.
Why is he looking at her like that? He just gave her a glance like as if she took the drugs.
I didn't lie. I said I was giving you a morphine-like drug that got rid of your cravings.
Does that sound like a drug addict to you? Yes, because anybody can be an addict. You were proof of that.
I don't have a
The
problem.
good news is that the brain is highly dynamic, as is the environment, but you need to stop now before the damage is irreparable.
Okay, and screw you.
Hey, Dr. Mohan will advise you on our proposed action plan. You can either choose to follow it or not. That is entirely up to you.
Absolutely.
I wish you luck, Mr. Puglisi.
So what this is, obviously a patient whiling out, but at the same time, it's like really complicated because how is she not going to wear that on her heart and her head and be like, this patient just told me screw you. And like she did the best thing for him, which got him out of his withdrawal symptoms, but still he's so ungrateful. And in fact, he is upset with her. So I do like how Dr. Robbie gave her a little lesson outside the room. And then also in front of the patient said, like, it's Dr. Mohan. We're not going to tolerate that type of disrespect. Go Dr. Robbie.
Dr. Robbie!
And Dr.
I've been
Mohan.
waiting in the lobby. Said you'd be right there.
We are a little understaffed, and truthfully, my head has been in a million different places. Can you forgive me? I'm here now.
Oh,
Please.
gosh.
What's going on?
I just love how he said that. It was so well written. Such a great transition of 3 statements that we could all use when we're busy and don't respond to texts or calls or haven't made plans. Like, it's been crazy, and could you please forgive me? And I'm here now.
And we will help you explain that this came from concern for his safety. What if you're right?
If I become a petitioner, what am I doing to my son?
You are trying to get him the help that it sounds like he needs. David lost his father. That would affect anyone. But we are failing young men because we don't teach them how to express their emotions. And then we let them get their lessons in manhood from toxic podcasts. And
Yes.
these young men then feel isolated from themselves and society, and they find community and comfort in all the wrong places.
Okay, go Dr. Ravi. Who knew this was going to be like a segment on healthy masculinity? I think it's so important to touch on this subject because he said they're going to not know how to share their feelings, name their feelings, share their feelings, and then get advice from toxic podcasts, which is so true. How do we as a society provide better emotional and psychological and community resources tailored for young men who will most likely remain silent if they've been wronged or been hurt or something happens? I just really love that he pointed out the complexity of the struggles of a single mother raising a child who lost the dad without placing blame on him or the loved ones. A lot of young men feel isolated and unsupported and lean on marijuana and drugs and social media or the internet to feel seen or heard and connected.
Gotta be more careful. You don't want these ending up in the wrong hands.
You can keep them.
You ever think about quitting?
I'm not a quitter.
Oh, I know. You're a happy drunk today. When your liver fails, and believe me, it will fail,
Yeah.
you won't be so happy.
I'm digging my own grave. Let me.
I don't have to give you the shovel.
I don't have to give you the shovel. Oh my gosh, that is so tough as a doctor to hear because let me tell you, I'm going to vent a little bit. You as a doctor, I want my patients to succeed. There is no scenario in which the patient loses and I win. The scenario is always, as a doctor and a patient relationship, that we both win or we both lose because my intention is always to make you feel better and get you the best help that you need. And your intention is also the same. So you want the best for you. But when this patient says, let me dig my own grave, he says, I don't have to give you the shovel. And that was just magnificent example of professionalism and patience. And Dr. Robbie's having to accept this person to make their own decisions. That's it for this episode. Let me know your comments and your thoughts below. Make sure to hit like and subscribe, share it with your friends who also love this show. Stay tuned. Here is the next episode in case you missed it.